Good morning, everyone. It's so good to be here. Thank you for taking the time to be here with us today. And I have an important information to share with you. So today, Dr. Vonda invited me to talk about a trending topic. So this topic we were not talking a few years ago because little did we know how important is the brain because we just didn't have access to it. Different from a dermatologist or from a cardiologist, if you do have a memory problem or you have any problems with your brain, there is no easy access to it, right? So over the years, our colleagues in radiology and other colleagues have worked over the time to see how we can access the brain in an easier way. And right now we have PET scans, we have MRIs, and we also have access to check our genetics. Because of this, we have been able to see different pathologies that happen in the brain. How many of you know when you're due for a mammogram? How many of you know when you're due for your colonoscopy? And how many of you check your brain? Do you wait until you have memory problems to show up in my clinic? It may be too late. So this is a typical story that I get every day. I see my patients that come to the clinic saying that they have been all the years working and saving money for their retirement. And right now they're 60 years old and they're forgetful. And the significant other that have been there all the time and they think that they're gonna be on a cruise in my island in Puerto Rico, they're in my office. So what can we do to delay the cognitive decline? We are all at risk because age is a risk factor for cognitive problems. There are different risk factors for cognitive decline, and we have modifying factors, and we have others that we cannot modify. And we're going to be talking about that. The ones that we cannot modify include age and include genetics as well. And we can spend a lot of time talking about this, and I only have 10 minutes, so we'll continue in another, or we can answer some questions at the end. But I want to make sure that we understand what is this spectrum that I have behind me. What is normal for age? What is having mild cognitive impairment? What is having dementia? And dementia is a broad term that actually has different reasons. So when we are demented, we have a cognitive decline and we're not able to take care of ourselves anymore. So under dementia, Alzheimer's is the most common type. After 65 years old, although it can happen in younger people as well. There is vascular dementia, there is frontotemporal dementia, and there's Lewy body dementia, just to mention a few. There's other types as well. Now, mild cognitive impairment. You're not normal for your age, but you're not demented. So it usually happens around 45 to 55 years old, that you start to be not as sharp as you used to be, but you still can manage. So you use extra effort. So what do? We use alarm clocks, we write things down, you use the GPS. So you have some problems, you're not demented, but you're not as sharp as you used to be. When you're in the mild cognitive decline, you have a higher risk of developing dementia every year, because again, age is a risk factor. So why don't we talk about the risk factors? Because I think that then the target should be, what are the modifying risk factors that we can take control to see if we can actually try to avoid getting into that dementia, or if we can manage the symptoms that are going to happen. And I'll briefly mention here some of the risk factors that are modified and that increase the risk of having dementia. So for example, being sedentary, low education, smoking, obesity, stress, high blood pressure, uncontrolled sugar, hearing problems, all those things that are mentioned over there, we test them and we talk about them when you come to my clinic because we can do something with those. So at the end, I'm going to just make some recommendations about what we can do and how we can prevent as much as we can, depending on somebody else. Because at the end of the day, what we want to do is live independent the longest. There are medications that are right now being developed at the research facility, at the research level. There are some medications that are out in the market yet, and there are two medications that we use to treat already the pathology of Alzheimer's. However, these medications would just slow the cognitive decline by 30%. So there's still 70% that is still happening. There are other pathologies, like for example, tau, that is still in research, that we think is playing a big role, but also inflammatory markers that we're seeing in the brain that are playing a huge role in the cognitive decline. And those inflammatory markers, we think that they may be coming from vascular problems. So the same problems that affect the heart may be affecting the brain. We also have insulin resistance. Have you heard about diabetes type 3? Right now there's a lot of research in that, and that's a main target that we would like to see if that actually would help. But for now, being a woman, we do have other risk factors that are different from men. And hormones play a big role. And you have heard other speakers talking about the hormones and talking about how this affects different areas of the body. It does affect the brain. It does cause brain fog. So the basis of NeuroFit program of just doing something before you actually have the symptoms include not only doing cognitive exercise, but also physical exercise, working with diet as well. And there's different things that we can be doing, like for example, eating a Mediterranean type of diet, that there is a lot of evidence that have shown that does help to decrease the risk of dementia. Having good hydration, at least 6 to 8 glasses of water per day is what we should be drinking. Physical activity, that's one of the most important things that we should all be doing. There is a lot of evidence about how cardio activity helps to slow the cognitive decline. And the cardiac activity should be, or the exercise should be moderate exercise. If it is just walking, it may not actually reach the protective levels that we're talking. Cognitive exercise is another thing as well. So cognitive exercise, learning something new, like learning a new language, something related to arts or craft, something related to music as well. So it's not only about doing Sudokus or doing crosswords, etc., which are good, but are only gonna make you good at Sudoku. We need to exercise the other areas of the brain as well. So this, you have to put it in a schedule, like going back when you were at school. We have to build that cognitive reserve. Cognitive reserve is the brain padding that helps us. When the hurricane comes, and we hear that in the news, what do? You go to the market, and you buy water, and you buy food, and you put your shutters, right? And you pray. And then, but besides that, it's the same thing. So I know I may have a risk factor. The risk factor may be genetic. The risk factor may be age. But there's something that we can do. Let's do it, and let's increase that cognitive reserve. Let's increase that brain pattern. If I do it and you don't do it, we both may be the same age. We both may have the same risk factor. However, I'm gonna live independent longer and better if I do have that protection. So that's where we have to be working while the science continues to work on different medicines that can be used on top of what we're gonna be, with what I'm saying here. So connecting with someone is so important to have social connections. During COVID, for example, that there was a social isolation, we got the highest number of consults for memory problems. Sleep is another thing that is very important. During sleep, we have found that the brain actually gets rid of the toxins. So sleeping at least 6 to 7 hours a night is really important, and addressing any kind of sleep problems, like for example, sleep apnea, is very important as well. Stress management. Anxiety and depression can cause memory problems. Anxiety in particular can increase the stress levels, can increase the cortisol, right? And that's an inflammatory marker for the brain. So engaging in yoga, meditation, Tai Chi, relaxation techniques is very important. Looking for other reversible causes of memory problems is important as well. You have to advocate for yourself. Go to your doctor. There is no time. I would not say that it has to be at 65 years, but that's the age that Medicare recommends. However, if you have a risk factor, like for example, your mom or your dad have Alzheimer's, if you I mean, if you just want to have a baseline, you should. The same way that you take care of the rest of your body. Go and be screened. Go and have your doctor check for vitamins. Deficiencies of vitamin B12, vitamin D can cause memory problems. Low thyroid can cause memory problems. Uncontrolled sugar as well. Same happening with medication side effects. So even getting the medications that you're taking on a daily basis and putting it all together in front of the doctor and running the list to see how you can improve. I'm just giving you here a very brief, as brief as I can talk, of a huge topic that we can be talking here hours and hours. The message is that the ball is in your court right now. What are you going to do with that information? Time is brain. Do something for you. Don't wait for the doctor to tell you. And please do not come to me saying that you have memory problems. There's a way to delay that. Thank you for being here.